Have you ever wondered if an old injury, perhaps a seemingly minor fall that resulted in a broken bone, could tell you something crucial about your bone health today? It is surprising how much one event can reveal about your body's strength and resilience. A prior fracture, especially one that occurred from a fall from standing height or less, is a very significant indicator in an osteoporosis diagnosis. In fact, for many people, such a fracture is considered a clinical diagnosis of osteoporosis itself, even if their bone density test results do not show extremely low numbers. This type of break is often termed a fragility fracture because it happens with minimal trauma, meaning your bones are inherently fragile. It is not about how hard you fell, but how easily the bone broke. This tells your healthcare team that the bone structure has been compromised to the point where it cannot withstand normal everyday stresses, a hallmark of osteoporosis. While a bone density test, also known as a DEXA scan, is excellent at measuring bone mineral density, it does not always capture the full picture of bone quality and microarchitecture. A fragility fracture provides direct evidence of this underlying bone fragility. It shows that your bones have already failed, signaling a higher risk of future breaks, even if your DEXA results are just in the osteopenia range, which is reduced bone density but not yet osteoporosis. Because of this, medical guidelines recognize a prior fragility fracture as a critical component in diagnosing osteoporosis. In some cases, a history of such a fracture means you meet the diagnostic criteria for osteoporosis, even if your T-score from the DEXA scan is not in the severe osteoporosis range. It essentially says, "We know your bones are weak because one has already broken easily." If you have experienced a fragility fracture, it is truly important to discuss this specific history with your doctor. Provide all the details you remember, including how the fracture occurred. This open conversation is vital. It allows your doctor to conduct a more thorough evaluation of your bone health, which might include ordering new bone density tests, blood work to check for secondary causes of bone loss, and reviewing your overall risk factors. This comprehensive approach ensures you receive the most appropriate care and management plan tailored to your specific needs. A prior fracture, particularly a hip, spine, or wrist fracture from a minor fall, is categorized as a major osteoporotic fracture. This classification is not just a medical term. It is a critical piece of information doctors use to assess your future fracture risk, often employing tools like the FRAX score. The FRAX score incorporates factors like age, gender, body mass index, and, importantly, prior fracture history, to estimate your 10-year probability of a major osteoporotic fracture. This helps guide decisions on when to initiate or adjust treatment, going beyond just your bone density numbers. Understanding the profound impact of a past fragility fracture on your osteoporosis diagnosis empowers you to take control of your bone health journey. It transforms a historical event into a vital piece of current information, providing a strong signal that proactive management and targeted strategies are essential to strengthen your bones, effectively manage your condition, and, most importantly, prevent future fractures. This understanding helps you work collaboratively with your healthcare team towards living a healthier, more active life with greater confidence.